Australia and other countries are calling for an international and an independent investigation into the origins of the COVID-19 outbreak in China. You've said this is not the time to point fingers or assign blame, but are you supportive of this investigation in the future? And do you still believe China responded and reported adequately?
I think it's extremely important that we understand exactly what happened and ask really tough questions of all countries involved, including China. This is something that we need to pursue. But my priority right now, and the priority for countries around the world, needs to be doing everything we can to keep our people safe and make sure that we have the resources necessary to protect our citizens and get through this. And that will always be my focus. Nous reconnaissons qu'il y a des questions importantes à poser et des réflexions sur comment ça s'est passé et quel genre de responsabilités différents pays, dont la Chine, ont dans cette affaire. Mais la priorité doit demeurer, pour moi et pour les autres leaders, comment on va protéger nos citoyens aujourd'hui et demain, comment on va s'assurer qu'on a tout ce qu'il nous faut pour nous garder en sécurité.
Ian Wood, CTV News. Prime Minister, a correctional facility near Montreal has confirmed dozens of COVID-19 cases, and the same is true with other facilities across the country, including one near Vancouver. What are you doing to protect the incarcerated population and the corrections staff in these facilities to stop the spread of COVID-19?
From the beginning, Corrections Canada has taken measures to protect both inmates and staff in these facilities, including eliminating visits, reducing transfers, looking at measures including staggered timetables to keep inmates and staff more separate from each other, ensuring that there are different mechanisms in place, and those reflections are ongoing. We're always looking for new ways to ensure protection of Canadians in those facilities.
And some provinces have had to cut elective procedures in hospitals to prepare and manage COVID-19 patients or prepare for them. Canada already has long wait lists for some procedures. Is the federal government going to assist provinces to make sure that these existing backlogs aren't amplified once we're through this?
We have a tremendous amount of confidence that provinces are going to be able to continue to manage their healthcare systems appropriately. We sent them $500 million in new resources to ensure that they are able to continue to deal with this crisis. One of the key elements through this crisis was ensuring that if more and more people got infected, there would still be emergency beds for them. There would still be intensive care units available to them to deal with the very real challenges of COVID-19 and prevent the death rates from skyrocketing as they have in other countries where their medical systems were overwhelmed. I think Canadians understand how important it is to make it through this crisis as quickly as possible so we can get back to normal. But getting through it as quickly as possible means being very careful about what we are doing right now to maximize our opportunity to help as many Canadians if they get infected.
Prime Minister Janet Silver, Global News. In Austria, for example, they have a plan to get businesses reopened, and they're doing it in a 2-week process. They open a business, a small business, monitor for 2 weeks. If the cases don't go up, they continue then with hotels, restaurants, etc. Provinces here in Canada, there are some that are have plans that they're announcing on how they're going to do that. I'm wondering what the coordination is between your government and the provinces. Will the federal government put a plan up as well? And what are you saying in terms of which businesses should be able to reopen first and when?
Many of the decisions around what makes sense in terms of a careful restarting of the economy are much more appropriately made at the provincial level, given both provincial authorities and the reality that the shape of this pandemic is very, very different in different parts of the country. What we are working on coordinating with the provinces is a set of principles and approaches that can be applied at different moments and in different ways across the country. We want to be there to ensure that there is testing capacity, that we are supporting on contact tracing, that we are remaining consistent in the messages that Canadians are hearing from the different orders of government across the country about how to be very, very careful to not allow for a resurgence of COVID-19 just as restrictions start being eased. These conversations are very much live with the provinces right now. We are listening very carefully to what experts and looking very carefully at what is working and has worked in other jurisdictions and seeing how and if that can be adapted to us. We recognized from the beginning that we have been slightly slower. We were able to hold off the pace of the virus in Canada for a few more weeks than many other places, and therefore we can take advantage of learning what works in different situations to adapt it to Canada. We are being extremely thoughtful about that easing, and again, people need to know it's not going to suddenly reopen in any part of the country overnight to what it was before. We're going to have to be very, very careful, very gradual, very progressive if we are to prevent the kind of resurgence that would send us all back into lockdown as we were before. We want to make sure that what we are doing now is not for nothing, that we manage to get through this with the kind of containment and control approaches that the proper measures will allow for. Okay. Nous savons que les gens veulent savoir quand ça va se passer, qu'on va pouvoir relâcher certaines des restrictions, mais nous devons de faire vraiment attention, de le faire de la bonne façon, de façon graduelle et de rester extrêmement vigilants. On est en train évidemment de s'inspirer de ce qui se fait ailleurs dans le monde, de leur succès et peut-être de leurs défis aussi. À différents moments, dans différentes parties du pays, il va y avoir des choix qui vont être distincts les uns des autres, mais en même temps, en tant que gouvernement fédéral, nous essayons de coordonner pour que les messages, pour que les principes sous-jacents à cette reprise lente et graduelle soient unis à travers le pays.
And an outbreak of COVID-19 at a northern Alberta oil sands camp has sickened at least 12 people around Alberta, and reports of other cases in other parts of the country from that. Should measures be in place to ensure that returning workers isolate whether or not they have symptoms?
I think that's a decision for the government of Alberta, but certainly we all understand how important it is to keep workers in essential businesses, workers who continue to work, as safe as possible. Safety of workers, of their families as well, needs to be the primary consideration of any government, and I certainly expect that to be the case in this one as well.
Merci beaucoup. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde.